Patient Education Lesson 12. This lesson will help us differentiate between instructional materials and teaching methods, the types of instructional materials and how to select, develop, and evaluate instructional materials, and how to design printed materials for educational use. Instructional materials are defined as the objects or vehicles by which information is communicated. Teaching methods are the approaches used to deliver patient education. The purposes are to help the clinician deliver the educational message clearly and creatively, accurately, and in a timely manner. Before selecting or developing instructional materials, clinicians should be familiar with the content and mechanics of the tool before using it, use it to complement other methods such as lectures, etc., realize that no one tool is better than the other, and that instructional materials may change learner behavior by influencing the three domains. Other factors to keep in mind are that the instructional materials should match the financial resources of the user, be appropriate for the learner's developmental stage, educational level, and sensory abilities, and should be current, accurate, and appropriate, should clarify information, and be free of bias or unintended content. When choosing instructional materials, consider the characteristics of the learner, medium, and the task. Characteristics of the learner to consider are the developmental stage, motivational level, learning style, reading and sensory-motor abilities, cultural backgrounds, and socioeconomic characteristics. Mediums may be print, demonstration, or audiovisual, and should complement the method of instruction and match the task, such as assisting learning in a particular domain or helping meet objectives. The three major components of instructional materials are the delivery system, content, and presentation. The delivery system may be either software or hardware used to present materials such as PowerPoint and a computer, or DVDs and a DVD player. Content is defined as the actual information that is given to the learner and should match the skills of the learner, be accurate and appropriate to achieve the educational objectives. Presentation is how the information is given, whether in concrete terms or aurelia, such as using actual people to demonstrate things, or mannequin simulations, or more abstract forms, illusionary representations, such as photographs, audio tapes, drawings, or in respiratory, breath sound tapes, and symbolic representations such as graphs, handouts, posters, whiteboards, etc. Written materials are a convenient, widely available, inexpensive, and acceptable way to give information and does not require a teacher. Since it is abstract and requires a learner to have a certain reading level, it may not be appropriate for low literacy or visually or cognitively impaired patients. It also limits feedback. Commercially produced pamphlets, posters, or brochures may be helpful but must be reviewed for content and value to the targeted audience. If clinicians write their own materials, it should be accurate, up-to-date, have a frequently asked questions area, highlight key points, and reinforce oral instructions or difficult concepts. All printed materials should be brief and clear, be appropriate to the audience, whether children or adult, be at the appropriate reading level, have an attractive layout and appearance, including plenty of white space, and allow for repetition of material and be in a familiar active voice, present tense, and use easy-to-understand terminology. The advantages of using demonstration materials, such as models, real equipment, charts, graphs, photographs, or drawings, are they are reusable, a good way to attract attention, portable, can change or influence attitudes, and can be purchased or made. Disadvantages are space and time requirements to set up. They may be overused or inappropriate for large audiences. Since posters are very popular display tools, make sure they have a title, plenty of white space, are visually appealing, use the KISS principle, keep it simple and smart, focus on the objectives, have high-quality visuals such as graphs or photos, and be free of errors. Models are useful when the real object is too small, too large, expensive, unavailable, or complex. It provides hands-on learning for tactile learners and provides immediate feedback. Models may not be useful for the visually impaired or may be too fragile, expensive, or bulky to transport and can only be used for a few learners at a time. Examples of models are replicas, such as dolls, analogs, such as simulation mannequins, and symbols such as formulas, mathematical signs, cartoons, etc. Audiovisual materials include 5 main categories: 1. Projected, 2. Audio, 3. Video, 4. Telecommunications, and 5. Computer formats. Computer technology is the most rapidly growing of all forms. Consideration should be given to the technical skills of both the teacher and learner, and any cognitive or physical limitations of the patient. Projected learning resources are PowerPoints and transparencies. The advantages are they can be modified for the hearing or low literacy patient and are good for teaching psychomotor skills. They are also easy to design, economical, and effective for a variety of audiences. Disadvantages include that they require a computer, can be distracting if there are too many or too busy slides, and may stifle active learning if overused. Audio learning resources such as CDs, radio, podcasts, and digital sound files are useful for visually impaired and low literacy patients. They are generally cheap and easy to use and can be listened to repeatedly. The disadvantages are the limitations to teacher-learner interaction and the reliance on one's sense. Video learning resources such as digital video files, DVDs, and webinars use both the visual and auditory senses, can be used for demonstrations and modeling, and are flexible and widely used. Disadvantages are time considerations and cost and technology available to the teacher or learner. Telecommunications such as TVs or telephones are widely available and can provide messages about disease treatment and prevention. They can generally be offered around the clock. The disadvantages are difficulty in setting up interactive capabilities and some limitations on repetition of information and lack of control over number and type of audiences. Lastly, computer learning resources such as computer-assisted instruction or CAI can provide interaction, quick feedback, and increased retention. It is time efficient and can be used for a variety of learners. Disadvantages are that it primarily teaches in the cognitive domain, requires software and hardware, and requires technical fluency in both the teacher and learner. When evaluating any instructional material, look at the patient's learning characteristics, the objectives to be achieved, and the media available. The clinician must remember that active learning and using materials and objects that closely resemble the real thing, realia, are best for enhancing retention. In the end, instructional material should support learning, not substitute for teaching.